Hello, my name is Emerald. I'm a nursing student from Hallmark University. I'm here to talk to you guys today about APGAR scoring. So, APGAR scoring is spelled APGAR, and it's a test that is used for medical personnel to look at the vital signs and the overall well-being and health of a newborn. So if you are, thinking about having a family or you already have had kids, when you take them to the hospital, the nurse or the doctor, usually it's the nurse, takes the baby. And if you ever thought about or, ever wondered, like, what are they doing with my baby? They are doing APGAR scoring. So from the moment the baby is born, for the first little bit of life that it has, they are testing your baby for vital signs. So in a normal human, our vital signs are taken on a machine or taken manually, and that includes our heart rate, our respirations, things like that. But in a baby, it's a tad bit different because they're totally brand new to the world. So let me get back to a little bit about what APGAR scoring is. So there's 5 main categories in APGAR scoring, okay? 5 main things that we're looking at in children. So we are looking at heart rate, okay? How fast is your baby's heart beating per minute, okay? You will get your stethoscope, you'll place it on your ears, you'll have the newborn there, it's crying, it's brand new to the world. You get the little bell, you place it on top of the chest, and you listen for a complete minute. And you're also assessing, how does the heart rate sound? Do you hear anything crazy? You will give them a score of 1 or 2. Now, the normal beats per minute for a baby is completely different from an adult. It will be 120 beats to 160 beats per minute. Anything above or below that, we are going to give them a score of 1 because that is not good. After heart rate follows respirations. How many breaths is your baby having per minute? You will again listen with your stethoscope and you count the rise and the fall of the chest, or you can also listen with your stethoscope. And the normal breaths per minute for a newborn baby is around 60 breaths. Now that would be way too high in an adult, but in a newborn, that's what it is. So anything above or below the range of 60, you will give them a score of 1 or 2. Now you're going to want to keep those in mind because at the end, you're going to have to add all these up. So following the heart rate, the respirations, we are going to look at the baby's muscle tone. Now, you are just going to pull on their leg very gently. You're not going to yank it, but you just pull on their leg, let it fall. When you were pulling, was there some resistance? You kind of want to feel like a little rubber band, okay? You want to make sure that muscle tone is good, but not overly flexed. You don't want the baby to be tight like this, and you don't want the baby to be extremely loose. So you will give them a score again of 1 or 2. And then following the heart rate, the respirations, the muscle tone, we are going to talk about the baby's reflexes. Now, babies are born with reflexes, and this is how they communicate with us. This is how they eat. So there's a couple of them you can check. I'm going to talk to you about 2. We're going to talk about, does the child have a startle reflex? When you pretend, you're not really going to, okay? But when you pretend to drop the baby, does it startle? Okay? Or sucking reflex. If you put your finger to the baby's mouth, is it trying to eat your finger? That's a good sign. We want them to startle. We want them to have a sucking reflex, okay? So you will give them again a score of 1 or 2. Okay? So following this, I'm gonna talk to you about color, okay? How does the baby's skin color look? Does it show a little bit of cyanosis? Now, cyanosis is bluish coloring of the skin, okay? Is it just in the hands? Is it just in the feet? That's pretty normal, so we would still give the baby a score of 1 or 2. Or does it have blue all over? Okay, that that is serious, okay? That also needs to be scored as well. Or does the baby have pinkish skin? Is the baby crying? That would give you a little bit of, that could also be a possibility as well. So remember APGAR, the heart rate, the respirations, the muscle tone, the reflexes, and the baby's color. Now, throughout each of the 5 categories that we were giving them a score of 1 or 2, okay? Now you're gonna, at the end of all of that, you're gonna listen to the baby, you're gonna add up the baby scores, okay? So if each one of them got a 2, you're gonna give them 10 points. If, let's just say on the heart rate, they got a 1, but on the respirations, they got a 2, that would be 3. So you just add them all up. Typically, a newborn baby is gonna have anywhere from 8 to 9. But some babies require a little bit of intervention. Do they need oxygen because they got a little bit of fluid in their lungs when they were coming out of the birth canal or something? So it's really important that you get a good estimate and you get accurate, measurements, because this really determines what kind of interventions the baby's going to get. Does NICU need to be involved? Do we need to let the doctor know about anything? So that is performed 1 minute after birth. And then we will go to 5 minutes after birth. We are going to reassess again. The same thing you did, heart rate, respirations, muscle tones, all of that, you're gonna do it again. And we're gonna compare the scores. So at 1 minute, for example, the child got 8, which is normal. And then at 5 minutes again, we perform another assessment, the child got a 9. Now, you will compare the scores. Did the child go up in score? Did the child go down? We want to see the numbers increase, but if we see the numbers decrease, that's okay. It just means it's going to require a little bit of medical intervention from staff. So, to kind of recap a little bit about what I'm saying, APGAR scoring is a tool that nurses use to assess newborns. It is essentially their vital signs compared to a human. It's their heart rate, respirations, muscle tone, reflexes, their color. You will give them a score. You will add up the scores from each 5 categories, and you have performed an assessment on a newborn.